Good afternoon, everyone. My name is Mai, and I will be hosting the webinar today on a very important and vital organ, which is our liver. I'm part of the wellness team at Prudent Insurance Brokers. If you read today's newspaper, the Times of India has published an article that showed 1/3 of India's population have fatty liver disease. And the most shocking part of that news is that 62% didn't know that they had liver disease. It shows a limited awareness that people have about metabolic health and basic health parameters that will help understand liver health and prevention. So with the right amount of prevention, it can save us a huge amount of money at an individual level as well as a corporate level in the form of insurance claims. And without further ado, I have with me Dr. Dheeraj Karant. Our esteemed speaker is a highly accomplished professional with an impressive array of qualifications, including MBBS, MD DMB, and DNB Gastro. With extensive experience in the field, Dr. Karant's expertise is second to none. Thank you. Over to you.
Thank you, Mai. Thank you very much for a nice and brief introduction. Good afternoon, everybody. I am Dr. Dheeraj, as Mai told. So today on the issue of World Hepatitis Day, I think it is worthwhile dealing with a topic that is going to become the next epidemic or pandemic in the world. This epidemic is about a liver which becomes fatty. It becomes fatty as we age, as we develop certain disorders, as we take certain drugs, it can become fatty. But like she was mentioning, as it's seen in today's newspaper, the study revealed that 1/3 of the population is definitely having fatty liver, and more than 50% of them, that is half of them, don't know that they have a fatty liver. There are two things which I would like to highlight before I start this talk. Number one is that you don't have to freak out if you have fatty liver. You can address it with the right amount of knowledge. You can address it with the right amount of approach to this disease and taking care of it in an appropriate way. Let's see what it exactly means to have a fatty liver and how we can try and circumvent it and bring it down to a minimal risk for our health. Okay. So in this slide, you can see on the left-hand side is the liver, which is depicted with this organ here, and the small purple thing here is a small ligament lying over the liver. And this is how it looks on an ultrasound. You see that the liver appears bright. So this is when you are, nephrologist or the ultrasonologist who is doing your ultrasound will tell you that yes, this liver is fatty, this is very bright. For the liver to appear this bright on the ultrasound, it requires 1/3 of the liver to be replaced by fat. So by the time you have diagnosed fatty liver, your 30% of the liver, 20% of the liver is already full of fat. So that's a very, very important thing that you should understand. So this is how a normal healthy liver looks on the left hand side, and how a fatty liver looks, because all yellow fatty deposition. The most common fat to deposit in the liver is a triglyceride. Now I'll tell you how triglyceride gets into the liver. So this is a chronology of events starting from a healthy liver, fatty liver. The next question a patient asks me when he comes to me with a diagnosis of fatty liver on ultrasound is, what next? What happens to me if I don't do anything? If you don't do anything, about 33% chance that you will progress slowly into a fibrotic stage wherein the liver will become shrunken and you start developing what is called as a cirrhosis. Once the cirrhosis sets in, there is a highly likely chance that about 2 to 10% of the people will develop a tumor within a liver, which is a small bump which needs to be extracted or needs to be treated in a different way. Now, although about 60% or 30% of the population has fatty liver, only a small chunk, about 1/3 of them, will progress to fibrosis or even lesser. Now our job is to find out why a person has had fatty liver and what we can do to prevent it from progression towards the right hand side to develop into a cirrhosis or a cancer. Now this is something that I think all of you should be aware. On the left hand side is a gentleman, who looks very obese, and he has what is called as a metabolic syndrome. I don't know whether many of you have heard about this term, but this is something that we should all understand. Unfortunately, the depicted figure on the left hand side is very obese. But let me tell you, even if you are not obese, if you are a very lean person, you can have fatty liver. You just need to have a right amount of metabolic abnormalities to cause fat in the liver. So be wary. Just being lean does not mean that you're fit. So lean is not equal to fit nowadays. Your liver can accumulate fat even if you're lean. It is called lean NASH, lean non-alcoholic steatohepatitis. Before we delve into this metabolic syndrome and non-alcoholic fatty liver, I want the audience to understand. All of you are common men. I would like to still tell you the commonest reason why anybody develops a fatty liver in the present day world is the metabolic syndrome. But even then, most people who drink alcohol will have a fatty liver. So alcohol related fatty liver is different from the NASH related fatty liver. If you are drinking alcohol, if you have a fatty liver, you should be doubly careful because you are having two poisons that can destroy your liver. One is a fat which is probably accumulated due to a metabolic syndrome which you have and which you are not aware of. Second, you are also taking alcohol which can cause fat in the liver. Now, what is this metabolic syndrome? There are five parameters which I have listed here. One of them is high blood pressure. High blood pressure, which let me tell you, half of you don't know whether you have high blood pressure unless you check for it. You don't have any symptoms. High blood glucose, again the same story. Unless you check, you won't know it. High lipid profile, again the same story. No symptoms, you will have high lipid profile. Waist size is something which you can easily see. This is something that makes you easily, be picked up amongst the group to say that you probably have a higher risk of fatty liver. But if somebody has a large waist size and none of these other parameters, then they are not at a high risk for a fatty liver. That's what is important. You've seen Japanese sumo wrestlers, they're very fit. You look at their fat is all in the subcutaneous tissue. So this fat is all in the subcutaneous tissue. It is not in the liver. It is not in the organs which are important or which matter to the patient. So you should be very careful. Just being obese does not mean that he has got some sort of a risk for a fatty liver disease. He should be accompanied. He or she should have all the other parameters which will culminate in a fatty liver. So the metabolic syndrome causes all these problems in the long run. It can lead to a heart disease, it can lead to cholesterol which is high, which can deposit as fat in the blood vessels, leading to high blood pressure. There is an association of this metabolic syndrome with diabetes. They can in the long term lead to dementia. These are people who have a higher risk of cancer. And you see very commonly nowadays young women, whether they are obese or not, because of the stress and the amount of the stress that they go through, the hormonal imbalances set in, and almost most of them have polycystic ovarian syndrome with irregular cycles. And of course, the thing that we are talking about is non-alcoholic fatty liver disease. Without alcohol, having a fatty liver disease. So if you look at it, it is a part of the metabolic syndrome. So here we have to address the metabolic syndrome in total and see what best we can do about it. So these are the numbers that you should have to call it a metabolic syndrome: a blood pressure more than 130 over 85, a triglyceride, which is a fat content in the blood more than 150 milligram, a glucose level more than 110, that is in the fasting state, a HDL cholesterol less than 40, and an abdominal waist girth in males more than 40 and in females more than 35. Diagnosis requires 3 out of these 5 parameters to be positive in any patient. So all these things lead to glucose intolerance, high insulin, impaired glucose tolerance, diabetes, atherosclerosis, and endothelial dysfunction. This is something that leads to both strokes and heart disease, and we should be very careful with this. How do we come across these people? About, like I said, like what was your yeah, um, chief was mentioning, that most of them are asymptomatic. They don't know that they have a disease. They do a routine screening and then they pick it up. But most others are using drugs. What are the drugs that can cause fatty liver disease? Most drugs which are related or treat psychiatric disorders like depression and anxiety, they lead to the fatty liver disease. The other commonly used thing that causes fatty liver is alcohol, which we should, try to curtail the use or use it as minimally as possible. And most people get, because they don't have symptoms, they get picked up during a routine screening for a master health checkup, and they pick up a fatty liver disease. Presence of diabetes, presence of thyroid disease, presence of sedentary lifestyle, sitting at the desk and working long hours, These are all risk factors for fatty liver disease. And of course, a person in a family who was obese and who had a family history of liver disease tends to have another high risk of having a liver disease because of fatty liver disease. Rarely, if any, patients have symptoms of fatty liver disease, so don't wait for symptoms. Screen yourself if you're obese, if you have high blood pressure, if you have sugar, if you have a sedentary lifestyle, with just a simple ultrasound and a lipid profile, and you'll pick it up. The only common symptom that I have seen in all my 12 years is that many people come with a little right-sided upper abdominal pain because the liver enlarges a little bit and causes a little discomfort. It is not a very severe pain, it is just a mild pain. What, as a doctor, do I look and eliminate before I tell you that you have a fatty liver due to non-alcoholic fatty liver disease? I eliminate alcohol by taking appropriate history. Of course, many people lie about their alcohol intake. You have to be very clear with the doctor whether you're taking alcohol or not. Hidden diseases, other causes of liver diseases like hepatitis B, hepatitis C, other metabolic causes of liver disease we look into. Viral diseases like hepatitis B and C, and of course, like I said, certain drugs can cause you to have fatty liver disease. Now, whether all fatty liver disease will cause damage to the liver, the answer is no. Fatty liver is something that cannot always cause damage. If it causes damage, it is called NASH. NASH is non-alcoholic steatohepatitis. In this stage, the liver is already getting damaged and it will lead to cirrhosis in the long run and sometimes to liver cancer, as I showed in the diagram above. Complications of other metabolic components like heart disease, stroke, and other cancers can happen with these people. So, if you look at it, fatty liver is just showing you that yes, this person has metabolic syndrome and he has a high risk of death due to any other reason other than fatty liver also, like a heart disease in the form of myocardial infarction, heart attack, or a stroke in the form of a cerebrovascular accident, or a cancer of any region. So these are the things that a fatty liver leads you to. So you should be careful. How do you avoid fatty liver disease? You avoid fatty liver disease by changing your diet, by doing good physical activity, and bringing down the amount of carbohydrates in the diet. Like everybody thinks it is not the fat that causes fatty liver, it is the carbohydrate. These carbohydrates get into the body, get converted into the fat, and get deposited in the liver. So our intake of fat comes through our carbohydrate. You see, in our country, rice in this part of the country is staple food, wheat in the northern parts of the country. So most of us are predominant carbohydrate eaters, unlike the West, where meat is a chief source of food and protein. So carbohydrates get converted into protein, into fat, and they get deposited in the liver. Unless you have blessed with great genes, this is bound to happen now in point of time. And again, your waist circumference is something that you should watch out for. Keep yourself fit. Try and eat more of fruits, vegetables, cut down the carbs, and try to exercise more, eat more of proteins. Avoid supplements at all costs. So how do you exercise every day about an hour or 40 minutes so that you keep yourself fit? Have a lot of green vegetables in your diet along with fruits, whole grains, and high fiber protein. The only thing is cut down the amount of carbohydrate, increase the amount of protein, maintain a good body weight, don't allow it to go beyond a certain point. And of course, zero tobacco consumption because this also leads to cancers. No smoking and absolutely no alcohol. How do you detect the fatty liver disease? You do a test called fibroscan in which you use a small probe. This probe goes, onto the liver like this, and the probe is placed here, and the probe sends radio waves to the liver, and it gets back the radio waves. If your liver is very stiff due to fat, there will be numbers that will tell us that you have a fatty liver disease, which is making the liver stiff, and you have to watch out, and it may lead to fibrosis or cirrhosis. Battery is low there. So fibroscan is one method of diagnosing fatty liver disease. This is how the radio waves go through, and through this small thing, they will pick up the reflected waves and tell you whether the liver is stiff or not. Most of the times with the liver function test and the clinical examination, we will try and make out the diagnosis of fatty liver disease. Many people say there is a need for a liver biopsy, but it is a very risky procedure where you poke the liver and then there is a chance of bleeding, some kind of patients have bled to death. So it is very important that you avoid liver biopsy and do your diagnosis based on many other parameters other than the liver biopsy. There are a lot of therapies for fatty liver disease. These are drugs of which you won't understand much, but my, you know, stress to you is on that you should change your lifestyle. That is the most important. Drugs, the doctor will take care of the drugs, but the problem is that drugs cannot be the solution. Lifestyle change has to be the solution. Best treatment is weight reduction. About 10% of body weight loss makes the fatty liver disappear. Maintenance of a low weight is the priority. Lifestyle with diet and exercise is the key. Close follow-up of these patients to look at their liver functions, whether it is getting damaged or not, is very important. And keeping away from alcohol is the key. Good control of metabolic syndrome parameters in the form of good control of diabetes, good control of blood pressure, good control of your cholesterol with medications, exercising regularly, eating a healthy lifestyle, eating a healthy diet is the key to avoiding fatty liver disease. I have not gone into the details and nitty-gritties of the diagnosis. Anybody has any doubt, they can ask me. But the thing is, the tenet of these things is that it is a very silent disease. You don't know unless you look for it. You should keep a healthy lifestyle, keep yourself fit, eat healthy, exercise daily. This is the key to avoiding fatty liver disease. Many of you are not blessed with great genes. You will have one or the other parent or one or the other parents inheritance from a very obese family member, and you tend to not lose weight despite your best efforts. Nevertheless, continue to do the effort, keep your efforts at losing weight. This will help you keep your liver fit and devoid of fat and makes you feel better. And also your liver functions improve when you try to exercise and keep yourself fit. Thank you very much.